Okay, so it's Wednesday. I've had my 24 hours, starting to feel uncomfortable. What are the steps?
So you would come into the office, and we would do what's called a COW score, which that's a nursing assessment that will let us know how severe your withdrawals are. And on that, we're looking for a certain level of your score that would tell us now it's safe to begin the Suboxone induction.
Okay, so my body is starting to elicit the signs of producing enough withdrawal for me
Yeah.
to start to counter that with Suboxone.
Absolutely.
Okay, and so what? And you said you start to give it. What does that mean?
So once you hit a certain score, we validate that your withdrawals are at a certain point. We'll give you a very small amount of Suboxone. And then we're going to wait for that medication to kick in. It takes about 20 or 30 minutes. And then we're going to take that score again. And ideally, what we want to see is that score to drop a little bit, that some of your symptomology resolves. Then we're going to administer another small dose of the medication, wait 20 or 30 minutes, administer the score again. And we're going to repeat that process until a point where the vast majority of your symptoms resolve themselves.
Okay.
So that's when we're going to know the medication worked. And that'll also give us an idea of an approximate dose of the medication that you need to be stable at. And I think that's a big advantage of doing it our way versus if you go to a doctor's office, they might guess, say, hey, you probably need X milligrams a day.
Yeah, they don't have the time to sit with you for that
right
period. Yeah, okay.
Absolutely. And then following that, we're going to send you home. You're probably going to be tired because your body's been through a lot. We're going to ask you to come back to the office the next day so we can again assess how you're feeling, assess how well that dose worked, and we can make adjustments over the upcoming days to your dose to keep you on what we call the minimum effective dose. We want you on as little of the medication as possible to treat your symptoms.
Got it. And so when this kind of uncomfortable experience is going on, obviously you guys are doing your best to make me comfortable as I'm experiencing these, kind of 20-minute build-ups in the amount that's in my system, which starts to make me feel better. If I was at a doctor's office, I would be on one of those rubbery beds with like the mechanics making go up and down, and a long white sheet of crinkly paper. Is that what I would expect at CMAR?
Absolutely not.
Okay.
No, we would have you in a very comfortable room that would have some food and snacks, as well as a TV to watch Netflix, to do whatever that to make your experience as comfortable as possible.
I want to go.
It's not too bad.
Yeah, that sounds great.
Yeah. I think the other important thing to talk about is what happens if somebody takes Suboxone too soon in their process.
Okay.
And this is something that happens fairly often, especially not in our setting, but in other settings where there is not medical people to supervise, they aren't doing the COW score. If somebody takes Suboxone too soon, what will happen is it'll push the other opiates that are still on your opiate receptors in your brain. The buprenorphine, the Suboxone, will push that off of those receptors, and it will quickly bring you into a state of withdrawal, and that's extremely uncomfortable. It's not dangerous in the fact that it can be life-threatening, but it's just a very unsettling way to start your sobriety and your recovery, and in my experience, it's a big trigger for relapse because the person using drugs is going to seek ways to avoid that experience.
Right. Okay. And that, and when you say kind of rapidly entering to detox, you're talking all of the unpleasant pieces from the expulsion of bodily fluids to, out of the various orifices to sweating. Is every single joint in my body going to feel like it's been ripped apart?
It's very uncomfortable.
Okay.
The term is called precipitated withdrawals.
Got it.
And again, it's not life-threatening, but it is it's extremely uncomfortable.
Right. And that's why at CMAR, we're not just going to say, hey, sounds like you need 24 hours, don't use for 24 hours, then come here, take your first dose in front of us, and then we'll start, taking you from there. We're going to actually probably err on the more conservative side to make sure that you don't waste a day coming into or a time coming into the office. But we're also, once you are in withdrawals, we're also going to actually test, like, okay, this person isn't like under the weather, they are in fact in withdrawal.
Correct.
Okay.
Yes.
God, that just sounds like a better system.
I think it's the best way that we can do it, and it certainly is a lot more convenient for a lot of people. The other alternative would be go to a medical detox
Right.
program that takes time out of your life. This is a process that we can do for the vast majority of people in one day in an outpatient setting.
Right.
You can sleep at home that night, and most people can even go back to work the next day feeling much better.
Got it. And then obviously, because it's an integrated addiction treatment program, are you also going to have kind of ready access to therapists and to case managers? Will those people are they in that same kind of general office, or is it a medical office then a therapy office? How does that work?
So all of our treatment services happen together in the same office. So you will have counselors available to you, case managers, and as soon as the induction is complete, we would expect and want somebody to then immediately begin their therapeutic recovery process. I think it's a core belief at CMAR that medications, even though it's part of our name, it's only one piece of the recovery puzzle, right? Lifestyle changes, behavioral changes, gaining support, accountability, and structure in your life are the key components of creating a lasting life in recovery.
Wow, that is really cool. So how would somebody get in touch if they wanted to, I don't know, start one of these inductions themselves?
Sure. They can call our admissions at 720-778-2627, or they can reach out to us on our website, www.colorado-recovery.com.